Mr. Haddad, your GP mentions you have some bleeding from the rectum. He is recommending we do a colonoscopy.
Yes, doctor, yes.
Can you please tell me a little bit more about this bleeding?
Doctor, I have blood every day blood.
For patients with limited English, there is a high risk of misunderstandings in communication if an interpreter is not present.
Mr. Haddad, you don't need an interpreter, do you?
No, okay.
Okay, let's go on.
Healthcare providers must assess a patient's language skills in order to establish whether an interpreter is needed.
Because of this bleeding and some family history of cancer, I am booking you in for a colonoscopy.
Okay, doctor.
A colonoscopy involves inserting a telescope, well, a camera really, into your anus in order to examine your bowel.
Camera? Big camera?
No, not big. It's tiny. You won't feel any pain because you'll be under anesthetic.
Okay, doctor. I feel no pain, doctor.
As with all procedures, there are some risks. You could have a reaction to the anesthetic and vomit. There is a risk of perforating the bowel. Bleeding is also a risk, but the risks are very, very low. So, Mr. Haddad, are you happy to proceed with the colonoscopy?
Yes, doctor, I happy.
A patient's reactions and body language alone are not enough to know whether they can understand. Out of politeness, some will smile, nod, and appear to understand.
I need you to sign the consent form here. Here it shows I've explained the procedure to you, and here is where you indicate you understand the risks.
Patients with limited English are often unable to provide their medical history, describe symptoms, or emotions. Healthcare providers also can't properly inform patients of their treatment options.
Now, Mr. Haddad, in preparation for the colonoscopy, you will need to fast.
Yes, doctor. I fast Ramadan.
Okay, like you did in Ramadan. Now, one day prior to the surgery, you are not to eat any solid food.
Sometimes patients think they understand because they can make out some of the words and then fill in the gaps. However, in many cases, what they grasp is very different from what was intended.
You must also prepare your bowel. You can get the bowel preparation, Pico Prep, from any pharmacy. Take this piece of paper and show it to them. There'll be 3 sachets of medication. Take the first sachet with at least 1 liter of water at 1 p.m. Take the second sachet at 4 p.m. and the third at 7 p.m. Pico Prep will cause multiple bowel movement. Make sure you are near the toilet.
Let's actually see just what Mr. Haddad understood.
Good morning, Mr. Haddad. Yes, I'm Nurse Khaliki. I will be looking after you today. Have you followed the instruction that the doctor explained to you?
Yes, I did.
Have you taken the Pico Prep?
What?
The medicine.
Yes, I took one yesterday.
So what time did you take the first sachet?
Sorry?
The first packet?
Yes, 1 o'clock.
1 o'clock,
yeah.
Good, at 1 o'clock. So what time did you take the second sachet?
No second, just one.
Just one sachet?
Yeah.
Why you didn't take the other 2?
Because my stomach pain and me have diarrhea.
You needed to go to the toilet.
Yes, I go to the toilet a lot.
But you're supposed to take the second sachet at 4 o'clock.
No, just one, no second.
Just one. Did you fast as you were told to?
Yes, I fast, yeah.
When was the last time you had something to eat and drink?
4 o'clock in the morning, just fast like Ramadan, before sun is coming up.
4 o'clock in the morning, this morning?
Yeah.
All right, 4 o'clock this morning. I'm sorry, Mr. Haddad. Just give me a moment, please. I need to speak with the doctor.
This unfortunate situation occurred because of an inadequate initial assessment by the doctor of the English skill level of the patient. Let's look at what should have happened.
Mr. Haddad, your GP mentions you have some bleeding from the rectum. He is recommending we do a colonoscopy.
Yes, doctor.
Can you tell me more about this bleeding?
Doctor, have blood, everyday blood.
How long has this been going on?
Everyday blood.
Mr. Haddad, do you understand me?
Yes, doctor.
If the healthcare practitioner has doubts about the patient's ability to understand and communicate in English, they should ask them whether they would like an interpreter and mention that interpreters in a healthcare setting are free.
Do you need an interpreter? Interpreters in healthcare settings are free.
No, doctor.
So you're fine, you understand me?
Yes, doctor.
Even if the client declines, it is still the healthcare provider's duty of care to ensure effective communication. Some clients may believe that their English proficiency is good enough. Others may feel embarrassed about their language skills.
Okay, let's go on.
In assessing a patient, ask a question which requires more than a yes or no answer.
Mr. Haddad, why are you here?
If the client has difficulty understanding relatively simple questions, then an interpreter is needed.
My doctor want me go a doctor.
Mr. Haddad, what are your symptoms?
Some what?
What is wrong with you?
Sometimes I have pain, sometimes blood.
Ask the client to repeat something you have said in their own words to check their understanding.
Mr. Haddad, a colonoscopy is a procedure where we put you to sleep and then insert a camera in through your anus to see what your bowels are like. We may do a biopsy. If we locate any polyps, we will remove them.
Okay.
Okay, Mr. Haddad. I want to make sure that I explain myself clearly. Can you please repeat what I said in your own words?
Yes, doctor. I sleep at night, and you camera and photo, and maybe stop bleeding.
If the patient's response is difficult to understand or not appropriate, book an interpreter. If there is any doubt about the patient's level of understanding, book an interpreter.
Okay, Mr. Haddad, I understand you speak Arabic at home.
Yes.
I suggest we use the telephone interpreter because even though your English is quite good, it will help with my understanding. So if it's okay, I will call the healthcare interpreter service.
Interpreter, okay.
Okay, just hold on a minute, please. Oh, hello. This is Dr. Leontini. I need an Arabic-speaking interpreter. Yes, a telephone interpreter.